Well, here we are. It's Monday, and I'm with David Ashford, Minister for Health and Social Care. We keep thinking this might be the end. Well, who knows? But the government's been dead quiet. I mean, nothing last week as far as press conferences. Now, that was a shocker because you thought when we talked last week there was going to be one. So what changed?
Yeah, we thought we might have something to update, Paul, but there was nothing really. It would have been delivering a press conference for the sake of delivering one. And now that we're in the mitigation stage, we're only really going to go out with the press conferences as and when we've got something to say or to update. Nothing had changed since the previous Thursday's update, so we made the decision on the Thursday morning, and there was no point holding it for the sake of holding it.
Because you stopped the run on the loo rolls and everything else, because every time there is one announced, it's like certain people do get a bit worried about the whole thing. So is this a new normal sort of basically?
Yeah, there'll be press conferences as and when we require them, or when we want to update on something. And just to emphasise again, if a press conference is called, it's not a reason for people to panic. Please read the notice around them. We're always quite upfront about press conferences. It will normally say on the media platforms it's just a general update, and people shouldn't read into that there's anything wrong.
So I'm still getting people coming to me saying the numbers aren't right, there's been a case here, been a case there, and nothing has been announced. So should we just put that, and one of the questions deals with that.
You can put it to bed, all cases are announced.
Yeah.
Things may
no
change.
Skullduggery going on.
There's no skullduggery, we're in mitigation now, so cases popping up. As I keep saying, the numbers aren't what matters now. So there would be no reason to have any skullduggery with numbers. There's never been skullduggery with numbers. We've always declared every single case we've ever had, and that will be the ongoing thing while we monitor it. I know there's people who say, oh, so such and such has had COVID, and when it's looked into it, turns out they haven't.
Where are we with everything else that's going on, though? Like the hospitals are up and running again. Masks, we didn't need one in the hallway here this week. Are we totally relaxed? Is everything back? Are you happy where we are?
Well, we're being vigilant, and I know Manx Care is being vigilant around their services still. We must remember we're not out of the woods yet. We're still rolling out the vaccine programme. We've got 80% of the adult population now vaccinated as of today, and over 70% of the entire population. But we just still need to be careful. It's a 2-dose vaccine programme. We're still starting the second doses now for the most vulnerable in our society. So we shouldn't relax completely and utterly. We still need to be vigilant.
And this, I know we talk about it all the time, but the reluctance now for certain people to have certain vaccines, that continues, I'm taking it, is it?
Not as much, and of course one of the things, great opportunity for me to emphasise, Paul, the change in advice around vaccines does not affect people going for their second doses. All the advice from the JCVI relates purely to first dose.
Now, we've had all these committees meetings and evidence being given. This week we've got the steam packet to issue in front of PAC, isn't it? Are you kind of worried about where we're going with this because of all the conflicting information that was given at the time about they were isolating, they weren't isolating, they were told to isolate? Anything you want to say on that?
No, as far as I'm concerned, they should give evidence to the PAC. At the time, as far as I was aware as Minister, they were complying with their isolation requirements, and that was what Public Health thought as well. And then, of course, we learned that the situation was slightly different, should we say, earlier in the year, and that's when conversations then began with the company.
It's going to be one of those standout moments, is it, that and your shredding of letters?
Well, we'll see what comes up on Wednesday with my hearing.
You on Wednesday?
Yeah, I'm on Wednesday.
Which
and then
committee are you giving it to?
So it's Public Accounts Committee.
Oh, it is?
Yes.
So this is the time when we finally hear about the rebuttal then, is it?
Yes, so yeah, I will answer all questions put to me by the Public Accounts Committee.
Fine. But after that comes out, you then will have this public rebuttal, will you?
Well, I think it will have been shared at the committee.
Right. So you expect to be taken through point by point by point?
I would expect the committee will want to go into quite detailed evidence sessions. There's myself appearing at one session and the CEO for the department, Catherine Magson, at a different session.
She's still zooming in, is she, though?
Yeah, so she'll be zooming into the committee earlier in the day. We'll both be giving evidence on Wednesday, and that'll be able to set the public record straight.
Wow. Is it going to be dynamite?
Well, we'll wait and see, Paul. Tune in.
Okay. That aside now then, and you know, we are looking at opening the borders, and this is the question I'm getting asked everywhere, and I'm sure I believe you stopped in Marks and Spencer's all the time to be asked that question, isn't it? Well, besides people saying keep the borders shut, and the other ones saying get them open, when can you open them up? Is it still?
Yeah,
keep the dates?
we're still on course with the exit framework at the current time for restrictions to be looked at again towards the end of the month, potentially level 2, and then of course that all important date, which is the release of borders on the 28th of June according to the exit framework. Now, things could change between now and then. And I know it is one of those things that divides people. There are people who think it's going far too fast. There's people who think it's going too slow.
Mm-hmm.
In fact, over the weekend, I received within the space of literally 2 minutes of each other an email from someone saying you need to open the borders now, and another email saying you need to leave them closed until the end of the year. So we do appreciate that. So that's why we are taking cautious steps that are based on the data, based on the infection rates within the UK and wider afield. And that's why we've got particular measures in place for certain countries.
And going with a traffic light system, people can go to Portugal and other places, if they're accepting anyone, of course, which is another matter in itself. But those countries like Australia, which clearly is not, whatever the UK does, the Isle of Man follows suit. It's as simple as that.
That is what we will be looking at. We will be looking for
that got to be
simplicity.
agreed, yeah?
It's got to be fully agreed.
Who agrees that?
When we move to the stages. So we will look at the situation at the time, and then it will be agreed by Council of Ministers, and then the relevant legislation will come forward to Tynwald.
So no one should be picking up the brochures quite yet, then?
Yeah, I've always said to people, I've been quite clear, we need to wait until we get to the time and then wait for the announcements. I don't think, to be honest, this year is a year to be planning your summer holidays in that way. I think that would be the case even if the borders were fully open. I think people should still be cautious for this year. I know it's frustrating, but as a community we still need to be aware that we are in the middle of a worldwide pandemic, and it can still affect us.
Now, Julian Watson got a change in the proceedings about timings. We were talking about this last week about the person who one day couldn't do the 1 week isolation, but it did get changed, didn't it, in the law, but by House of Keys or
yeah,
whichever it was?
5 days on, so the numbers were radically reduced.
Were you upset it had got changed? Because
I voted for it, Paul.
Right. But did you think that was, when we talked, it wasn't going to happen?
Because of the numbers involved, if you remember, I said all new direction notices would have to be issued, which was the case. Yeah. But I was advised by the time we reached the Tuesday that the numbers in isolation had radically reduced because we were already 5 days on by then from when the regulations came in. So it made it more practical for the team to be able to do it. So on balance with the number of people involved, I cast my vote in favour. And
how busy has it been for people who now can get in on this new system anyway? Were you really swamped with numbers trying to get their approvals? So
111 has done an absolutely excellent job. I think it was 368, I think, was the over that bank holiday weekend was the amount going through. So the team have worked exceptionally hard to ensure that they could deliver. They've yet again pulled it out of the bag, and I believe the process has been running very smoothly in that regard.
And then it's presumably decreased after that initial enthusiasm, has it? Or?
Yeah, I haven't seen any recent numbers, but I would imagine obviously the big bit would be the bank holiday weekend, because that's when people have got a much bigger run at being able to isolate.
So tell us about the next date in the diary. That's the end of this month, isn't it? What exactly happens again? Remind us.
So that is level 2, when we would look to further reduce restrictions. There would be a reduced isolation period, reduced testing before people could be released. That is the current plan. The full detail around that will be announced at the time we make the decision to move to level 2.
So again, that's in flux to some degree, that you can tweak it, or
there will always be potential tweaks because it will depend upon the situation around us. So the exit framework is a guide. It's a very good guide. We've delivered on level 3. But level 2, there may, for instance, be the decision made that although you can go out after 24 hours and one test, there may be further restrictions for several days around venues people can visit. That might, for instance, be something that would actually be put in place. But we all know that when the decisions are made.
And finally, unexplained. We're at 0 still, are we, at the minute? Unexplained, nothing worrying you?
No, there was just that one that popped up that still remains unexplained. But as I've said, we're going to have this now.
Yeah.
And as you have a more vaccinated population as well, one of the things that has been shown with the vaccine is it makes people asymptomatic. So there may well be more and more cases of unexplained because you're not able to trace back through the asymptomatic cases.
I suppose the Indian one is what everyone's talking about. And, we're still on this lag of 7 days or whatever to get that information. But have you had any tests for that one to prove positive so far?
So if you're talking about the genomic testing,
yes.
5 days it is.
Right.
And we haven't had any Indian variant on the island. There's been none of that. In relation to the genomic testing, again, I do need to emphasise it doesn't change the response. having that information on variant does not change your response to a case. You still isolate it and you still deal with it in the same way. And if there was a widespread outbreak on the island, then the same measures would be taken regardless of variant.
Okay, well, the biggest ticket in town is going to be Wednesday. What time?
Wednesday. I've got to get the time right now. I think it's 3:00. I think.
How long can they hold you for? As long as they want.
Well, it's an hour, but I tend to overrun on parliamentary hearings.
And
so
it's going to be gripping stuff.
They may have been inflicted on them a bit longer.
Okay, don't miss it.